Before moving to any of the spinal asymmetry series or any of the other spinal mobilizations, it's going to be important that you know the difference between type 1 and type 2 spinal motions. We're going to be talking about side bending of the spine as well as rotation of the spine. Type 1 means that you move in opposite directions. Type 2 means that you move in the same direction. It's easier to remember type 2 because 2 is together. That means that you would pair rotation and side bending in the same direction. Let's apply it. So what you want to do is have your arms out. I'm going to take one side of my body and I'm going to move it into a side bend. And then what I want to do is in the same direction, I'm going to rotate. So here we have, you can see that my arm is side bending and rotating in the same direction. That's our type 2 mobilization. Now, if I simply take this arm and side bend it, but bring the arm across the body the other way, now you see that my arms are going in opposite directions, and I'm now creating a type 1 spinal mobilization. So a maybe simpler drill for you to really get this is to take one arm out in front of your body, reach it across your body, and what I want you to do is take your opposite arm and bring it overhead. Now I'm rotated in one direction, and I'm side bending in the opposite. Now what I can do is I can just switch that. Let's experiment on the other side. And you can do a quick self-assessment of yourself to see which motion feels better or maybe freer. But now what I want to do is I want to take my arm, I'm going to rotate it back, and I'm going to side bend toward my arm. Now you'll see that my arms are moving in the same direction, so this is our type 2 mobilization. And then go to the other direction and see how that feels compared to the other side. And so there you have it. You have type 1 is opposite motions, rotating one direction, side bending the opposite, and then you have your type 2 motion, which is together, which means rotating in one direction, side bending in that same direction. I hope this helps. If you have any questions, be sure to ask your trainer.